Okay, guys. So let's say you have a patient come in and you know you want to use ultrasound. So depending on what kind of impairment your patient has is going to determine what type of ultrasound you're looking for or what kind of effect you want to have. So let's say you have a patient with soft tissue shortening. They have some tight areas and they need you to help them stretch them out. We want to use a thermal effect for that, right? So we would choose thermal ultrasound. Let's say they had delayed tissue healing or prolonged inflammation. We're going to choose non-thermal ultrasound. So if we have that patient who needs some help stretching out with muscle or tissue shortening, we need to choose a 100% duty cycle. So this just means that 100% of the treatment time that we're planning on using, the wavelength coming out of the ultraset is active the entire time. If we want a non-thermal effect, 20% of that time of your treatment time, you're going to have activity coming out of the ultrasound head. This is going to keep us at non-thermal. So let's say we know we've decided duty cycle. So the next part is to think about our anatomy and figure out how deep is the tissue that we're working with. Is it 1 to 2 centimeters or is it around 5 centimeters? Excuse me. If it's 1 to 2 centimeters, we know we need to use a higher frequency at 3 megahertz. 3 megahertz doesn't go as far, but it does warm up tissues faster. So that's why we use that one for superficial heating. Or if we have the deeper tissues, we know we need to use 1 megahertz. Same thing for non-thermal. More superficial tissue, use 3 megahertz. Deeper tissue, use 1 megahertz. Now, what determines the next part is ultrasound intensity, which relies on the frequency. If you're going to use the higher frequency, you need to use a lower intensity when it comes to thermal ultrasound so that we don't overheat or heat too quickly the tissues in the area. Now, when you're coming to non-thermal, you're going to stay at a low intensity so we don't run into the possibility of having any thermal effects in the non-thermal area, no matter which frequency we use. Now, duration of treatment. If you look at this part of the slide, it says 5 to 10 minutes for 2 times the ERA. So based on what size ultrasound head you use, it should be 2 times the surface area. Your surface area of treatment should be 2 times the area of that ultrasound head, and when that's the case, it should be a 5 to 10 minute treatment, depending on the amount of tissue activity you want to create.